Hello. This week we are going to study adolescence. So I hope you enjoy the discussion of the physical and cognitive development in adolescence from Chapter 11 and the psychosocial development in adolescence in Chapter 12. Please remember that we also have our next exam coming up. There are learning objectives for both chapters. We'll start out with Chapter 11. By the end of this chapter, you should be able to discuss the nature of adolescence, describe the changes involved in puberty, as well as changes in the adolescent brain, identify adolescent problems related to health, explain cognitive changes in adolescence, and summarize key aspects of how schools influence adolescent development. Let's get started with a little writing exercise. These writing exercises are good to see what you remember from your readings and to prepare you for any essay questions you might see on your exam. Take just 1 minute or up to 3 minutes and answer what are the various influences of school achievement. Take about 3 minutes and write 1 paragraph to address 3 or more of the major influences mentioned in the lecture last week or in your textbook. When you get done, come back and we'll do a quick review of those. Well, I hope you did take the time to stop the video and to try to write some short paragraphs. You will find the answer to this in your textbook on pages 237 to 240. But here are a few hints from me. First, self-efficacy beliefs. Students that believe in their abilities do better than students who do not. When we believe in ourselves and that we can master schoolwork and regulate our own learning, we do better. Gender plays a factor. Girls tend to do better than boys and are less likely to repeat grades. But there are variances based on courses and tasks. Parenting practices also matter. Parents tend to create the learning environment both positive and negative. They do this by providing a place to study and books in the house. Socioeconomic status in and of itself do have a big impact on schools, neighborhoods, family atmosphere, and others. Peer acceptance is important. Boys and girls that are disliked by their peers tend to do poorly. Education reform was regulatory oversight and testing that was designed to improve the educational system. There is a lot of debate about whether or not it did that or it resulted in people teaching to the test. Class size matters. The research is mixed on whether reducing the class size matters, but certainly it impacts how classes are taught. Media use. Computers have been shown to be beneficial for girls' achievement, but violent video games have been associated with increased aggressive behavior in boys. Charter schools and homeschooling is mixed. Charter schools tend to show better math and science outcomes. Homeschooling is questionable at best and only studies and all of their studies have serious methodological problems, which again would argue against homeschooling. Influences of COVID-19, you have all lived this. School closings are likely to exacerbate the social and economic impacts on children. Well, let's get busy talking about adolescence. Adolescence is an age that's between about 11 and 20. And again, this is a social construct. It depends on where you live and what you're reading. When I worked in an adolescent clinic, we would take people up until they reached their 22nd birthday, which is my way of saying it depends, but on average, it's between the ages of 11 and 20. It is recognized as an age group globally. However, it does vary. Puberty is an important aspect of adolescence, and adolescence has gotten younger because puberty seems to be starting at a younger and younger age. Many young people during this period of time choose their occupational path, and it's helpful when they are in agreement with their family and their abilities, but we all know this isn't always the case. And for many young people, this is also the age of marriage. A lot of people still get married in their late teens and early 20s. Puberty begins at about age 8-ish for girls and about 9-ish for boys, and it lasts about 3 to 4 years. Take a little time to work through this slide or figure 11.1 in your textbook. And while you learn some of this now, you're going to learn a lot more about it in some of your other nursing courses. Puberty is a time of hormonal response. The hypothalamus releases gonadotropin-releasing hormones, and it triggers luteinizing hormone and follicle-stimulating hormone. In girls, the follicle-stimulating hormone, abbreviated FSH, leads to menstruation, and in boys, the luteinizing hormone, abbreviated LH, causes the release of testosterone and aldosterone and androsterone. And this then stimulates androgens. And the androgens in boys basically cause the development of some of the secondary sexual characteristics, penis enlargement, pubic hair, and enlargement of the testes. It's also a time when you will start seeing adolescents who are getting acne. In girls, the estrogen then leads to the development of breast, the development or the full functioning of the ovaries and the uterus. This is divided into basically 2 different time periods. And if you look closely, you'll see the top portion is adrenarche and the bottom portion of the slide is gonadarche. The primary and secondary sexual characteristics in boys and girls are something that you've lived through, so you should recognize them. Primary sex characteristics are necessary for reproduction. During puberty, the organs enlarge and mature. So in girls, that's ovaries, fallopian tubes, the uterus, the clitoris, and the vagina. And in boys, it's the testes, penis, scrotum, seminal vesicles, and the prostate gland. The secondary sex characteristics are physiological signs of sexual maturation that do not directly involve the sex organs. So they're things like the breast in females, broader shoulders in males, and changes in voice, skin, pubic hair, facial hair, and axillary hair. And there is a nice table here for you to take a look at. Just for a little terminology, you should know that when we're talking about sexual maturity, for males we're talking about spermarch, which is around age 13 in boys, and this is generally the age when they start having nocturnal emissions. For a lot of them, this catches them off guard, even though you would think that they would have heard about it from friends. Menarche in girls is between 12 and 16, and it is marked by the onset of menstruation. So there's a big age range for this to occur in girls. There's also adolescent growth spurts, and this happens younger in girls than it does in boys by about 2 years, as much as 2 years. So girls, their growth spurt is between 9.5 and 14 and a half year old, and for boys it's from 10.5 to 16, which means you have this period of time when girls are taller than boys in their teenage years. There are environmental factors that impact some of these things. There's a belief that plastics and chemicals have had an impact on girls. We know that there are differences based on race and ethnic factors in girls, and we know that that boys, especially boys who actually mature earlier, that it can have a negative impact on them. There's an association with substance abuse, delinquent behavior, and even conduct disorders. The adolescent brain is also changing. There are dramatic changes in brain structures and emotions, judgments, organizations of behavior, and even self-control. We know the white matter, which is the nerve fibers, change and increase, and we know that the transmission time increases. We know that that it is a time, because our brains are maturing from the back to the front, that all of the pieces that allow us to have good self-control and good judgment are not fully connected and functioning yet. But that being said, self-control, judgment, and organization of behavior is starting to improve. So the gray matter first increases in the frontal cortex, and then the density declines greatly, and especially in the prefrontal cortex. And essentially what it's doing is it's kind of pruning the unused synapses. And so kind of like when you prune a rose bush, it then grows better. Well, it's the same thing with your brain. When you prune all those unused synapses, it functions a little bit better. Because the brain develops from the back to the front, the risk-taking parts are developing before the controlling parts, which is why you see teenagers involved in risk-taking behaviors, and we're going to talk a little bit more about some of those risk-taking behaviors. Erik Erikson's chief task of adolescence was to confront the crisis of identity versus confusion. Identity versus confusion is the fifth stage of Erikson's theory. This stage occurs between the ages of 12 and 18. During this stage, adolescents explore their independence and they develop a sense of self. This is the stage of ego identity. Adolescents develop a sense of self through social interactions and new experiences. It can also be the period of role confusion, which can occur when adolescents don't get to explore and test different identities. It can result in them being unsure of who they are and where they fit. So this is a time when you will see adolescents changing their hairstyle, their clothes, their friends, taking up new behaviors and new hobbies. This is all positive, and it helps them to decide who they want to be. But we're going to talk more about some of these and how they actually explore. Physical activity is one area. Good is good. Good physical activity is a good thing. Greater than 1 hour a day of physical exercise and vigorous physical exercise is needed in adolescence. This helps them to increase their strength and their endurance, to have healthier bones and muscles, to control their weight. It reduces anxiety and stress. It increases self-esteem. Kids that have increased physical activity tend to do better in academics, and they have enhanced well-being. Inactivity is bad, and it's bad because adolescents are generally healthy, so they don't see the consequences immediately, and they may not experience the negative effects for years. But we know that the behaviors that are developed during this time period tend to carry with people through adulthood. Sleep. The American Academy of Sleep recommends that adolescents between the ages of 13 and 18 get 8 to 10 hours of sleep. Now, most of them actually do this. Sleeping less than what is recommended can result in a decline in their academic performance. It's linked to attentional issues and to learning problems, and they are at higher risk of accidents and injuries. Nutrition is something that is also important with this age group, but most adolescents do not eat enough fruits and vegetables, and they do eat too much fat and too many calories, which again is why the exercise is so important. The average American teen scores 52 out of 100 on the Healthy Eating Index. 15%, a little over 15% of high school students are between the 85th and 95th percentile on BMI. Now, I hope all of you remember what this means. And BMI is the body mass index. And when we're looking at people prior to adulthood, we tend to look at percentiles of where they should be rather than looking at the percentages of BMI as we do in adults. 14.8% have a BMI that's greater than the 95th percentile, meaning they are obese. So 85th and 95th is overweight, and 95th and above is considered obese. Overweight teens tend to become overweight adults with all the predictable health and psychological consequences that come with that. Now let's talk a little bit about a couple of eating disorders. And two of the ones that are more common that you will hear of are anorexia and bulimia. And they are a little different. Anorexia, and both of them are very uncommon. Less than 1% of adolescents will have either one of these. So in anorexia, they tend to abuse laxatives, diuretics, enemas, and other things to lose weight. They do, in bulimia, they do the same thing, but they're doing a lot of things to prevent weight gain. They both tend to have binge eating, and they both tend to go to the bathroom right after meals and induce vomiting, which can cause dental caries. Now, this is where we start talking about some of the differences. In anorexia, they have frequent weight lifting and compulsively exercising. Frequently weighing and compulsively exercising. And in bulimia, it's more about the frequent weighing. And then back to anorexia again, they're restricting the amount of food that's eating. They're cutting their food into small pieces, which essentially means they're doing more playing with it than they are eating it. They tend to have perfectionist behaviors, low blood pressure, and extremely sensitive to cold, largely due to the very low body fat. Weight loss, wasting of muscles and fat, blotchy and yellow skin, fine hair, and no menstruation are common. And remember, if you don't feed your body, it will feed itself. It just starts eating away at itself. And so if you don't give it food, it eats the muscle. And then it can result in depression, confusion, and slow thinking. And in bulimia, you tend to see more self-induced vomiting, and you also tend to see some overachieving behaviors. There are treatments for these disorders. The immediate treatment goal of anorexia is getting the patient to eat and gain weight, and the treatments include behaviorally focused outpatient therapy. If it's really severe, admission to a hospital for 24-hour nursing care. And you need to know the mortality rate in anorexia is about 10%. People really do starve themselves to death. And then less than half ever make a full recovery. Bulimia is often treated with medications and cognitive therapy, and the patients keep daily diaries of their eating patterns and learn ways to avoid the temptation to binge. About 30 to 50% of these people have full recoveries. And you need to know that there is 10 times greater risk of suicide. Now let's talk about another behavior, and it's a risk-taking behavior, is substance abuse. And abuse can lead to addiction. Adolescent brains, remember, they are still developing, and alcohol can have a disproportionate effect on them. It results in lower white matter and changes in the prefrontal area involved in executive functioning. So, who remembers what executive functioning is? If you don't, you may want to go back and look it up. But executive functioning helps you to manage time, pay attention, switch your focus, to plan and organize, to remember details, to avoid saying and doing the wrong thing, and to do things based on your experience, and then to multitask. Although multitasking is overrated, none of us really do it well. Another risk-taking behavior that you will frequently see in adolescents when they're deciding who they want to be is smoking. Whether it's tobacco or marijuana or anything else you're smoking or vaping, it damages your lungs. Cigarettes will kill half of all lifetime users and increase the risk of cancer, heart disease, stroke, emphysema, and other diseases. And we know a lot less about marijuana, and we know a lot less because it's really rare when a person uses only one drug. So it's a little bit hard to separate out what's the effect of marijuana and what's the effect of other drugs that are being used. The risk of alcohol and drugs in teens is important to recognize. Teens exposed to alcohol and drugs before the age of 15 demonstrate an increased risk of substance disorders, risky sexual behaviors, and low educational attainment. All right, let's try a question. What issue of adolescence are they most subject to disclose? Any guesses? Alcohol. It should be noted that teens exposed to alcohol and drugs before the age of 15 demonstrate increased substance risk behaviors and risky sexual behaviors. But again, this is one of the risks they take that they're usually willing to disclose. But pay attention to depression and emotional changes. And I just put a list together here of some of the things that you might see. What you need to know is that 13.3% of adolescents between 13 and 17 experience at least one episode of depression. Girls are more likely to suffer from depression than boys. Some of the risk factors that you may see include a family history of depression, stress, anxiety, substance abuse, diet and sleep pattern changes, and poor physical health. And you will notice that some of these are on this list, but frustration and feelings of anger, even over small matters, feeling of hopelessness or feeling empty, being irritable or having an annoyed mood, loss of the interest in pleasure in usual activities, low self-esteem, feelings of worthlessness or guilt, and there is an increasing list. But these are things that you will want to be familiar with. Let's talk a little bit about death in adolescence. It does happen. So it's slightly different from other age groups. The greatest risk of suicide, for example, is in Native American boys. An average of over 16,000 teenagers between 12 and 19 years old died in the United States every year from 1999 to 2006. There is less than 1% of all deaths that occur every year in the United States. So for the most part, we don't see a lot of death adolescents, but it doesn't mean it doesn't exist. The 5 leading causes of death among teenagers are accidents or unintentional injuries, homicide, suicide, cancer, and heart disease. Accidents account for nearly 1/2 of all the teenage deaths. So, as a category of those deaths, motor vehicle fatalities is the leading cause of deaths in teenagers, and it represents about 1/3 of all those deaths. Among teenagers, non-Hispanic black males have the highest death rate, 91.1 deaths per 100,000 population. And then homicide is the leading cause of death in non-Hispanic black teenagers. For all other groups, accident is the leading cause. This is something that we need to pay attention to, and hopefully your generation will change this. It should never be the case that homicide is the leading cause of death for any teenager. Now we're going to shift and talk a little bit about Piaget. We already talked about Erikson. So let's cover a little bit of what you need to remember as far as Piaget's formal operations theory at this time. Adolescents enter what Piaget called the highest level of cognitive development, formal operations, when they move from concrete, real-world stimuli and develop the ability to think abstractly. This does not happen overnight. This is a process. Beginning around age 11, children can use symbols to represent other symbols in algebra, better appreciate hidden messages in metaphor and allegory, and think in terms of what might be versus what is, and can form and test hypotheses. Hypothetical deductive reasoning is what we think about as scientific thinking. Hypothetical deductive reasoning involves a methodological, scientific approach to problem solving that is characterizes formal operations thinking. It involves developing and testing a hypothesis. We're going to give you an example in a minute. Psychologists have critiqued Piaget's work. Many adolescents and adults seem incapable of abstract thought as Piaget defined it. And Piaget paid little attention to social and cultural influences or other cognitive advances like metacognition, which is thinking about thinking, which may be the chief advance of adolescent thought. So let's think about an example. Who wants to actually explain this? How fast does the object swing and from what height to make the balls bounce? If you showed this to a 6-year-old, they're in a pre-operation state. They would have no ability to solve this problem. And they may just think you just shove it harder, or you put more weight on it and shove it harder and see what that does. By age 10, they're in concrete operations thought. So they may think the length of the string matters or the weight of the object matters. But they still can't solve the problem. At age 15, the approach to problem solving is systematic. They know that you can vary one factor at a time, that you can hold other factors constant, and they are basically able of hypothetical deductive reasoning. I don't know anyone that hasn't played with a pendulum at some time. But when you're 6 years old, you really don't understand how it works. By the time you're 15 years old, 16 years old, almost everybody understands how this works. The other thing that's happening rapidly is language development. Vocabulary continues to grow, and by 16 to 18 years old, they have a vocabulary of 80,000 words. And this is really important to their academic achievement. And the more you read and the more you interact and talk with people, the greater your vocabulary grows. With abstract thought, adolescents can define and discuss abstractions such as words like love and justice and freedom and what that all means. Adolescents are more skilled at tailoring their speech. They're better at using simpler words when talking with a child, or swearing when they're talking to their friends, but not when they're talking to their parents, and showing deference to adults. One of the other changes is in their moral development, and we're going to talk about two different approaches. As children get older, they are more capable of complex reasoning. So we're going to explore Kohlberg's stages of moral reasoning and the work of Carol Gilligan on prosocial behaviors, and she disagreed with Kohlberg somewhat, and also thought his approach was a little sexist. But Kohlberg and his colleagues studied moral questions with 75 boys that were ages 10, 13, and 16, and they followed them for 30 years. Now, all of these boys were boys he knew. They were all boys of the same socioeconomic status and were in the same essential neighborhood with him. He essentially believed that moral development came from moral reasoning, which was linked to cognitive development. He believed the heart of every issue was justice. If you look at table 11.2 in your textbook, it walks you through the stages and gives you examples of typical answers to moral questions. I used a slightly different graphic for you because I think it's a little bit easier to follow. But in stage 1 is orientation toward punishment and obedience. Children obey because they don't want to be punished. In stage 2 is instrumental purpose and exchange. Here, children conform to rules because it meets their own self-interest. So, I'm not stealing because I don't want to go to jail. In stage 3, it is maintaining mutual relationships, approval of others, and the golden rule of do unto others as you would like them to do unto you. Children want to please others and to be seen as a good person. In stage 4 is the social concern and conscience. This is the time of recognizing a duty and showing respect for authority and the need to maintain social order. In stage 5 is the morality of contract, of individual right, and of democratically accepted laws. People think in relational terms and value the welfare of the whole society. And then in stage 6 is the morality of universal ethical principles. People do what they think is right as an individual, regardless of the law or the opinion of others. They act based on their own standards. Gilligan's theory of sex differences is the development of moral reasoning during adolescence. Gilligan asserted that Kohlberg's theory was sexist and oriented toward values more important to men than to women. Women, Gilligan argued, hold a different set of values that place caring and avoiding harm as higher goals than justice. And research has found little support for Gilligan's claim of a male bias. She has since modified her position and found that gender differences in moral reasoning are small. And then I'm going to give you this quote from Gilligan. Yet herein lies the paradox, for the very traits that traditionally have defined the goodness of women, their care for and sensitivity to the needs of others, are those that mark them as deficient in moral development. The infusion of feeding into the judgment keeps them from developing more independent and abstract ethical conception in which concerns of others derives from principles of justice rather than compassion and care. I will tell you, by today's standards, it would never be considered acceptable to only study boys and then to apply that to girls. Everybody would say that is inherently biased. So let's talk about prosocial reasoning and behavior. Prosocial behavior typically increases from childhood through adolescence. Girls tend to show more prosocial behavior and empathetic concern than boys, and this difference becomes more pronounced in adolescence. About half of adolescents engage in some sort of community service or voluntary activity, and students who volunteer tend to be more engaged in the communities and see better academic and civic outcomes. And we know in our society today, this is also something that you see the high school students then put on their applications for colleges and universities, because we consider this important. And in the past, we tended to only look at SAT and ACT scores, and now we look at these other factors which are also predictive of academic outcomes. In Western education, we kind of assume that students are motivated to learn. Many U.S. students are, however, not self-motivated, and motivation often declines as they enter high school. However, students who have high self-efficacy, which is who believe that they can successfully achieve an academic goal, are more likely to do well in school. This is to say, like the little train, I think I can, I think I can, I think I can. If you think you can, you are more likely to achieve your goal. There are some differences in gender and achievement. Social and cultural influences uh, do impact gender differences on achievement. Home influences and parents' attitudes and expectations correlate with math achievement. School influences, such as subtle differences in the way teachers treat boys and girls in math and science, have been well documented and adversely impact girls. Neighborhood influences, where boys benefit more from enriched neighborhoods, but they're also hurt more by deprived neighborhoods. And then women's and men's roles in society do help shape choices of courses and occupations. And finally, cultural influences have an impact on performance and correlate with the degree of gender equity in our society. So we know that reading tests conducted on 15-year-olds in 72 countries show an advantage for girls, although the scores narrowed between 2009 and 2015. We know that gender differences in science are actually small, but boys are more likely to be top performers in all countries except Finland. And then finally, male and female brains show some differences in structure and organization. Social and cultural factors may include home influences, school influences, and societal roles. So, once again, we learn nature and nurture matters. Likewise, dropping out of high school has gender differences. In 2017, the dropout rate was 5.4%, and it was higher for boys than girls. We can ask ourselves, why are poor minority adolescents more likely to drop out? Reasons include low teacher expectations, differential treatment, and less teacher support than the elementary level. Again, this is something that many of us would refer to, at the very least, as rather systematic bias. Dropouts are more likely to be unemployed and to have low incomes and to end up on welfare and become involved in drugs, crime, and delinquency. This is why we need to do everything we can to keep every child in school. And then finally, the last piece of Chapter 11 is your research and action and about teens and media multitasking. More than 25% of adolescents' media consumption occurs using at least two types simultaneously. Evidence suggests that adolescents are not producing high-quality work while texting with friends and listening to music. Media multitasking is associated with poor academic performance, decreased working memory capacity, and using a cell phone while driving is compatible to driving drunk. This is not just in adolescence. This would be true at any age group. We always seem to want to take pride in being able to multitask. The truth is, none of us do it well. It hinders our performance, and our results are worse because of it. So it's important to learn to focus and to stay focused. Moving on to Chapter 12, let's start with our learning objectives. By the end of this chapter, you should be able to discuss identity formation in adolescence, describe adolescent sexuality, characterize changes in adolescent behavior with family and peers, and describe adjustment problems of adolescence and strategies for intervention and risk reduction. We will start and review the chief task of adolescence. According to Erikson, the chief task of adolescence is confronting the crisis of identity versus identity confusion. Successful resolution of this stage results in the development of fidelity. Fidelity is sustained loyalty, faith, or a sense of belonging to a loved one, friends, or companions, which is why you see such strong friendships develop in adolescence. Erikson's definition of identity is a coherent conception of the self made up of goals, values, and beliefs to which a person is solidly committed. So what is crisis of commitment then? Crisis does not refer to a stressful event, but is a process of actively grappling with what to believe and who to be. Commitment involves a personal investment in an occupation or ideology. Commitments can be held after, only after really, they are deeply considered. So let's talk about what this means. When we are talking about a crisis, we are not talking about the stress related to a death in a family or wrecking a car. We would certainly think, oh, that's what we mean by crisis. In this context, that is not what we mean. We are not talking about stressful events. We're talking about actually grappling with what you believe. One example, there's a couple of examples we can give about grappling with what you believe. One is grappling with who you want to be. What do you want to do as an occupation? If you really like woodwork and you really want to be an artist that works with wood, you might spend a lot of time grappling with, do I want to go down this road? As opposed to going to college and becoming an engineer or a nurse. They're very different paths, and you may say, I really love woodworking, but the risk of me being poor or lower income could be high. But if I go to college, I'm probably going to do well. This is what the type of crisis they're talking about. Who are you and what do you want to be? The commitment is when you invest in making that decision and you decide which path to take. So again, a crisis isn't that stressful event. It's actively grappling with what to believe. Marcia's categories of identity status include identity development being multidimensional, and she identified 4 categories. They are identity achievement, foreclosure, moratorium, identity and identity division. So let's talk a little bit more about these. Identity achievement, or crisis leading to commitment, is important. After working through an issue, the adolescent makes a commitment and is supported for that commitment, and if they are supported for that commitment, will be more socially competent. So if you work through, do you want to be a woodworker or a nurse, and you have a supportive group of family or friends, then you are more likely to be socially competent. Foreclosure, or a commitment without a crisis, is when an adolescent makes a commitment by uncritically accepting the family's plans. Well, it's what my mom and dad want me to do. The person may be self-assured, but becomes dogmatic when he or she or her opinions are then questioned. These people tend to be people with close family ties that are basically obedient. Moratorium, or crisis with no commitment, or no commitment yet, is when grappling with one's identity and trying to describe for him or herself when he or she wants to, what he or she wants to be, and what path to take. Um, in this case, the person may be lively or talkative and self-confident, but is also tends to be anxious and fearful. Finally is identity diffusion or no commitment and no crisis. And this is when one seriously considers options but then avoids any commitments. These people tend to be uncooperative. All right, I think it would be a good time for those listening to take a break and find one of your classmates and do a little group exercise. Um, and with this group exercise, I want you to think about what we just discussed: identity achievement, foreclosure, moratorium, identity, and define your identity status and provide one example of that. And you only need a group of 2 or 3 friends to do this, but it will help you remember if you can use yourself and your identity status to provide an example. When you've had a chance to do that, come back. There are racial and ethnic influences on identity formation. In the United States, while it's starting to significantly change, we're largely European Americans. And European Americans growing up in the U.S. generally are the predominant white culture. And thus, ethnic identity formation isn't particularly troublesome to them. Although, if you ask many white Americans to tell you why they're proud to be white, most of them can't do it. And it shows you the way in which they don't think about race and culture because they haven't had to. For many young people in minority groups, race and ethnicity is central to identity formation. Perceived discrimination can interfere with identity formation. In the process of cultural socialization, parents teach children about their racial and ethnic heritage and promote cultural practices and cultural pride. Other forms of identity include sexual minority youth. In adolescence, sexual orientation generally becomes more clear. Sexual orientation is the focus of consistent sexual, romantic, and affectionate interest. Heterosexuals are attracted to the opposite gender, homosexuals the same gender, and bisexuals are attracted to both genders. Transgender are individuals whose biological sex assigned at birth and gender identity are not the same. This is a very small minority of people, generally about 1/3 to 1/6% of the population. Usually, they are not gender. Usually, they know they are not gender conforming by about the time they're 7.5 years old. The full realization, however, doesn't happen until around 13 to 15 years old. Some people may seek gender affirming or hormone therapy or surgery, and those that do not successfully integrate into their sexual identity in their self-concept are at risk of anxiety, depression, and conduct problems. Sexual orientation seems to at least be partly genetic. Segments of chromosomes 7, 8, 10, and 29 appear to be involved. The brains, we also know that the brains of gay men and straight women are symmetrical, whereas in lesbians and straight men the right hemisphere is slightly larger. Family structures also play a role. The more older biological brothers a man has, the more likely he is to be gay. Let's talk a little bit more about sexual behavior. About 39% of high school students have had sexual intercourse. And in 2017, 41% of male students and 37.7% of female students reported being sexually active. Two of the major concerns are the risk of sexually transmitted infections and of pregnancy. Now, you need to pay some, attention to these numbers because people notoriously inaccurately report sexual behavior. This figure in your book, 12.1, shows you the percentage of high school students who were sexually active by sex and grade. Again, you will notice males and females are about the same, but you will notice the rate of sexual activity increases with each grade. This is not at all surprising. Some of the factors that are associated with early sexual activity include early puberty, poverty, poor school performance, history of sexual abuse or neglect, cultural or family patterns, and perceptions of peer norms. In other words, this is largely about your environment and a little bit about genetics being early puberty. One of the things that people can do to prevent early pregnancy is the use of contraceptives among sexually active teenage girls, and this has increased since the 1990s. Teens are more likely to consistently use contraceptives when they delay intercourse, discuss contraception before having sex, use more than one method of contraception, and we should know that almost 80% of teens who have sex for the first time now choose to use a condom. This, of course, is the best method and the only method, short of abstinence, that will prevent sexually transmitted diseases, and even then, that is not always effective. Sexually transmitted infections are infections and diseases that are spread through sexual contact. It is estimated that 19.7 million new STIs are diagnosed each year, with over half in young men and women. Risk factors include early sexual activity, multiple partners, a failure to use condoms, and barriers to sexual health services. The most common STI is human papillomavirus, which we call HPV, the leading cause of cervical cancer. The Centers for Disease Control recommend routine vaccination for female adolescents starting at age 11 or 12. It is also now recommended that young males are also vaccinated for HPV. The most common curable STIs are chlamydia and gonorrhea. If untreated, these diseases can lead to severe health problems. Comprehensive sex education really is critical to controlling the spread of STIs. But as I'm sure you all know, all of this is very controversial in public schools. And the truth is, a lot of people would rather let kids get STIs and become pregnant than teach them about sex. And here is a graphic that shows you the pregnancy, birth, and abortion rates in the U.S. for 15 to 19-year-olds. And this is important because what you notice is the rate of pregnancy, abortion, and births have all decreased consistently since around 1990, where they peaked, and since then they have all been consistently coming down. A substantial decline in teenage pregnancy has accompanied a decrease has accompanied decreases in early intercourse and multiple partners and an increase in contraceptive use. And programs that focus on teen outreach have had some success by combining comprehensive sex education and access to family planning services. Some contributing factors include being in foster care, being abused, exposure to parental divorce or separation, and domestic violence and abuse, and a family member with mental illness or criminal behavior. Many teen moms are impoverished, they're poorly educated, they don't eat properly, they do not gain enough weight, and they get inadequate prenatal care, or they get no prenatal care at all. They are also at an increased risk for academic problems and for dropping out of school, which of course then leads to a life largely in poverty. However, 2 decades after giving birth, most formal adolescent mothers are not on welfare. Many have finished high school and have jobs, and they do have large family. And they do not have large families, which is important to know because that is a common myth. There are many things that we've done to try to prevent teen pregnancies, but surprisingly, MTV's Teen Mom had a significant impact on it. When people saw what is essentially a reality show of teenage motherhood, basically the teen birth rate dropped. Teen girls were not the least bit interested in living the life of a teen mom once they saw what it really was. Now let's talk about adolescents and parents. Adolescent rebellion is actually relatively uncommon despite what you would see on TV and what you might hear. Individuation involves the struggle for autonomy and differentiation or personal identity. So it's important for parents to balance between too much freedom and too much intrusiveness. As academics, we frequently call this helicopter parents. And helicopter parents are these parents that are way too intrusive with their lives of the kids. While parents need to be supportive of their children, being too intrusive is not helpful to them. Now, I want to come back to the concept we discussed earlier of self-disclosure. Teens and parents disagree on types of behaviors that are expected to be disclosed. Parents of teens agree that prudential issues involving health and safety are most subject to disclosure. Moral convention and multifaceted issues such as lying or seeing an R-rated movie are somewhat subject to full disclosure. Personal issues such as how teens spend their time and money are the least subject to disclosure. So let's think about this. If I inquire what is usually subject to disclosure, what would be one example? Well, one example I will give you is breaking promises to parents is usually subject to disclosure. Well, it's not like they don't know anyway, but still, it is usually subject to disclosure. Family structure and economic stress are problematic for families, but they're also problematic for adolescents. Adolescents living with their continuously married parents tend to have significantly fewer behavior problems than those in other family structures, single parents, cohabitating parents, or even step families. A major problem in single parent families is lack of money. So teens are more likely to drop out of school and show declines in self-esteem and mastery if their mothers have unstable employment or are at work out of work for more than 2 years, which generally means the family will be in poverty. Adolescents that spend more time with their friends or their peers they spend less time with their siblings. Uh, of course, then sibling conflict declines across middle adolescence. Well, it's partially probably declining because you're spending more time with your peers than with brothers and sisters. Siblings really can exert both positive and negative effects on each other. So if you have a sibling that's a good example, you're more likely to follow that good example. But if you have a really bad relationship, or you have a sibling who has bad behaviors or abuse or is abusive, then that can be problematic. So let's think a little bit more about adolescents and their peers or their friends. As children move into adolescence, the peer social system becomes more diverse. Cliques, which are structured groups of friends who do things together, become more important in these years. And it is a time when adolescents tend to make a larger number of friends, but the friends they have tend to be closer friends. A larger type of grouping, the crowd, such as people refer to as the jocks or the nerds, does not normally exist before adolescence. Crowds are social constructions based on reputation and identity. And keep in mind one of the reasons this is important, because remember, the kids that have fewer friends, they tend to, or have no friends, they tend to not do as well in school, and they also tend to be at greater risk for depression. Adolescent friendship is perhaps one of the most important aspects of this time period. And it's probably more important than any other period in their life. As intimacy increases, adolescent friendships are more reciprocal and stable than childhood friendships. Adolescents who are intimate with friends tend to do well in school, and they also tend to have higher self-esteem. It's important to make sure that the family structure is supportive and making these friendships and these relationships possible. The other aspect of adolescence is the romantic relationships. And romantic relationships are a central part of most adolescent social worlds. They typically move from mixed groups or group dates to one-on-one romantic relationships that does involve passion and a sense of commitment. By age 16, adolescents interact and think about their romantic partners more than their parents, more than their friends, and more than their siblings. The relationships with parents may affect the quality of the romantic relationships. Remember, your parents are your first models of romantic relationships, but also parents can be a little bit jealous when they're starting to see their children grow up and shift the love from them to others. So, what does having an opposite sex do for you? An opposite sex sibling do for you? Well, one of the things that it does for you is it increases the perceived romantic competence from early adolescence. And I think that probably has an important impact in how adolescents adapt and how they interact with their peers. So, what do you think adolescents think about romantic relationships? First, in middle adolescence, they think about romantic partners more than they think about their friends. And for the most part, that seems to last the rest of your life. Thank you. And as always, if you have any questions, please feel free to join me for office hours, and I will be happy to answer them.